Welcome to Priya's Picks, a series of special bonus episodes between seasons to connect you with the assets you need to build knowledge and get the best care possible as a woman in America. In these bonus episodes, we'll interview the writers, podcast hosts, and media makers behind some of my favorite women's health resources. I'm Priya Bhathija. I've spent the last 22 years working to make healthcare better for women. And in that time, I've read almost every book out there on women's health. And this is one of my top picks. It's called The New Rules of Women's Health, Your Guide to Thriving at Every Age by Meghan Rabbitt. This book is seriously no joke. When it came in the mail, I was shocked at how long it was and how much it covered. I quickly realized that was the point. It's a comprehensive encyclopedia of women's health, divided into sections that you can flip through whenever they are relevant to your journey. It covers everything from puberty to fertility to menopause, with gut, bone, skin, and heart health in between. Today we're talking to Meghan about her book, but also about what she learned about owning and advocating for your health, and where she thinks digital tools and AI fit into the mix.
Hi, I'm Meghan Rabbitt. I am the author of The New Rules of Women's Health. I've been a longtime health journalist, really dedicating my career to interviewing experts to find out what they're researching and how I can help translate that research into language we all understand and action steps we can all take to really improve our health and our lives.
For this book, Meghan interviewed the best experts in women's health from across the country. It's clear, easy to follow, in-depth advice that every woman should keep close by. But she didn't just wake up one day and decide to write the most comprehensive book we have on women's health. Instead, she got a little push.
Yeah, Maria Shriver asked me to write this book for her imprint at Penguin Random House. She really wanted me to take a big swing. She said, Meghan, I want you to write a women's health manifesto covering everything from puberty through menopause and beyond. And so when Maria Shriver asks you to do that, you get to work. I will tell you that.
Now let's dive in. Meghan, I love this book. It has over 600 pages. It's very comprehensive. Can you tell us a little bit more about sort of what you hope women will gain from this book and how they can use it, right? Because I know from my perspective, I didn't need to read every chapter right now, but I know they're there and I can come back for them at a later date.
Yeah, I love that question. And thank you for asking it, because I think a lot of times, someone will pick this book up and say, oh my goodness. I mean, it's like almost 700 pages, right? So it is a big book. And the design, when I was reporting it and realizing how big it was going to be, if I really needed to cover everything I wanted to cover, the goal is for you to have this as a reference. It's for it to be on your bookshelf where you can say, oh, I've got my annual gynecologist visit. Like, what do I need to keep on my radar? Or, gosh, I feel like I keep hearing about perimenopause. And am I going through the symptoms? Like, what even are the symptoms? And then you might open up this book and turn to the menopause chapter. I found the breast health chapter was personally really important for me when I found a lump and it led to more testing and my first breast MRI. And that chapter really helped me say, like, okay, before I freak out, what are all of the different things that a lump can be? What do I need to ask my doctor to really make the most of the appointment? And so that's really how I designed this book, is so you could tuck in. And actually, there's a puberty chapter, which for a lot of women listening, they're going to be like, well, that doesn't apply to me, but it sure does apply to the young women in your life and all the ways puberty has changed. And isn't it great to have an understanding of that so that we can support the young women coming up behind us? And so that's really the goal. And a friend of mine gave me a high compliment after she got the book. She said, I think this needs to be a coffee table book, because don't you want the men in your life and our sons and our husbands and our besties who are men to pick it up and to say, oh, what's this? And then you can be like, here's this chapter, read it so you can help support me through this health challenge I'm going through.
Yeah, 100%. I love that idea. And I love it from the perspective of moving far beyond bikini medicine or boobs and tubes and really representing the full picture and scope of everything that is included in women's health. And I found it particularly helpful because I have PCOS, and I think it's hard to find resources that you can trust on PCOS. And I was about to go to an appointment with a new endocrinologist, and I was like, well, let me read up on that and refresh myself on the history of how I got diagnosed with this, why I have it, and what are some of the things I should be talking about with my doctor in that appointment. And it was so helpful, even though I've had that diagnosis since I was 17 years old.
Yeah, I can relate to that in a different way, but another gynecologic concern. For years, I was dealing with the symptoms of fibroids. So fibroids are benign growths in the uterus, and I had no idea I had them, but I did have a lot of symptoms that, frankly, I brushed aside because I didn't know enough to bring it up with my doctor. I didn't know enough about the landscape in order to say, oh, wait a second, I should probably not be brushing this off as no big deal and talking about these very specific symptoms with my clinician. And I think as women, sometimes we get the, I call it the gold star. We want a gold star. Look at what a great patient I am. Look at how great my body is doing. And we focus on what's right versus allowing ourselves the space to say, wait a second, these are some things I think you should know about. And I wonder if I would have gotten a diagnosis of my fibroids way earlier, which would have given me more treatment options. And so that really was a North Star and a guiding principle as I was working on this book. Is gosh, I wanted to create a resource where women could do exactly that, to say, is this normal? Is what I'm dealing with something that should be concerning, or should I bring it up to my doctor? And then when I do, I really feel like when we have the knowledge we need and the language we need to talk about our health, we just get so confident, and that's how we have more productive doctor's visits, because we can be in that flimsy paper gown and say, wait a second, I know that you know bodies, but I know my body. And here's what's new for me. Here's what's different. Here's what I read that's based on evidence that I need to talk to you about. And man, that is so empowering.
Yeah, it really is. And that's what we did in building the playbook for season 1, was really talking through that doctor's appointment and what you should bring in and how you should have that conversation, and how asking questions doesn't make you a difficult patient. It makes you a good patient, right? And I think your book really gives women the foundation they need to have that education before they walk into their doctor's appointment, and also maybe after their doctor's appointment. If they brought up issues that they didn't really know much about, they have an opportunity to rely on your book.
Yeah, and dive deeper. And then what I would say, one of the surprises that turned up in my reporting is that doctors are like, look, make another appointment with us. We might not be able to cover everything in one visit, but we are definitely, if you have questions after your visit, make a telehealth appointment where we can just talk about a couple extra concerns that came up. And so, yeah, I love that. It's if you still feel a little confused, dive into the chapter, have a better understanding, and then say, no, I do need another appointment, and I think it could happen on a virtual visit.
One of the pieces of feedback I've gotten consistently after folks have listened to season 1 of this podcast is they didn't realize they could ask for that second doctor's appointment. They didn't realize it was on the table for them. And even just knowing that takes a little bit of pressure off the original doctor's visit, because you don't have to feel like you have to get to everything in 15 or 20 minutes.
Totally. And in fact, what I also learned from a primary care physician I interviewed for my book about how to make the most of an appointment, what she said, and it was such a good reminder, is that if you're coming for your annual exam, we can't cover all the things. It's not possible in the time you have. And I think even in a concierge model where you might get a lot of time, you can't cover all the things. Your doctor needs to do a physical and check off all of her boxes for what she needs to cover. And so it's really important to go into a doctor's visit with a plan and understand that if it's an annual, your doctor has an agenda, just like you might have an agenda. What she told me, and I think it is really great advice, which is to keep track in the few months before you have an appointment, or even a few weeks or even a few days if that's what you have, and really just keep track of all the things you want to talk about. What are the things that are annoying you? What are the things that are impacting your health, your daily life? Write them all down. But before the appointment, organize that list in order of priority in terms of how they're impacting your life. Bring that list with you to the doctor and say these words. Hey, doc, I know we're probably not going to have time to cover all of these concerns today, but here's what feels most important to me. here's everything I'm going through. Can you just take a glance and help us come up with a game plan for how we're going to tackle this? And she said suddenly as a doctor, she's like, I am going to be like, thank you. You get that I don't have all the time in the world, even though I wish I had all the time in the world for you. And it builds a bridge between you and your doctor that's just going to help set the tone for a better appointment.
I think that's such great advice to those that are listening and sort of navigating this in their annual appointments or in follow-up visits. Hey, it's Priya. I just wanted to pop in here and encourage you to send this episode to a friend. The information we're sharing here is so valuable, and it's how we help each other get the best care possible as women in America. So hit the share button on whatever app you're listening on. Send it to your daughter, sister, aunt, mother, a coworker, or honestly, send it to every girl dad you know. Because the more we all know, the better healthcare will be for everyone. Okay, back to the play. So one of the things that I really liked about the book is it didn't just limit this conversation to the medical conditions that we will face in our life, but you go beyond that to talk about staying informed in the digital age and really finding the right places to get information that you can trust. And many of our speakers already on the podcast have talked about using Google, using AI in different parts of this process associated with a doctor's visit. And I'd love to drill down on that with you a little bit more. Like, can you share some tips for Googling? Like, how do we Google the right medical information? Or as you say in the book, Google like a doctor.
Yeah, I think we all need to learn how to Google like a doctor. And also, I would add like a health journalist. You know, what I want to do is help you understand right now in this moment exactly how I look for information. And it matches up with how doctors do too. So first and foremost, what you want to know is a skill called lateral reading. So this is, you open up your browser on your computer. Let's say you use Chrome or Safari or whatever it is, and you open up like 10 tabs. Open up brand new tabs. In the first tab, you're going to search the condition you want to learn more about, PMOS, let's say, formerly known as PCOS, because you're like, I wonder if I have the symptoms, right? And so you might do something like PMOS and symptoms. And then when you get the search results, you want to look for big medical institutions, peer-reviewed journals, doctors who are writing about the topic, who are reputable, who aren't then trying to sell you a bunch of PMOS supplements on the next page, on their homepage. And then in the next tab, you might do another search. And again, look for all of these things. You want to vet your sources really, really closely. That's really important. I think that lateral reading skill is especially important when we find things on social media. You might see an influencer or even a doctor on social media saying like, the birth control pill is the worst thing in the world. And if it raises a red flag, you should listen to that red flag and then be like, okay, hold on, wait a second. What do other doctors say? As a health journalist, I need to corroborate my information. I need to get multiple sources that are reputable to say the same thing about information before I feel like, oh, okay, this is something I should write about. And so that's really, really important. And I think in this day and age where we are bombarded with information, it really is good to have a healthy sense of skepticism. Another thing that doctors do and that health journalists do and that we can all do is be really wary of big claims. This supplement will help you sleep like a baby. Like this exercise is going to help you drop 10 pounds in the next 10 days. It's like, if it makes you go, is that too good to be true? There's a chance it's too good to be true. And it should be another one of those red flags to make you say, okay, wait a second, I need to look into more information on this.
A lot of times it's not just Google, right? So we have AI at our disposal now, and a lot of AI searches are now being integrated into Google searches, and it's hard to know sort of what is giving you what. But how do you use AI in this process of women's health and meeting and talking with doctors?
There's a section on AI in my book that I'm really proud of because I interviewed an expert in these large language models, LLMs, that are how ChatGPT exists, right? In Notebook LM. And what she said is that, think about it, these LLMs have been trained on the internet, on what we've been, writing about for years, and what we've been writing about and putting on the internet is sexist, is racist, does not take into account the differences between female and male health, largely because we haven't had a lot of research up until very recently. And so we really have to take those AI results with a massive grain of salt. Understand that the information that AI is pulling from is not always the cleanest, for lack of a better word, when it comes to what's really going to matter for us as women and our health journeys. And know that. That's not to say don't use them. But keep that in mind. And again, you have to fact check the AI results you get. I would not just talk to ChatGPT about all of your menopause symptoms, and whatever ChatGPT says, take as the, word of God, or like what your doctor would say. Like, no, use it as another, should I trust this information? Let me do that lateral reading skill and open up a few tabs and say, okay, let me search this. And what does the Mayo Clinic say about this? Let me search this result AI gave me and say, what does Cleveland Clinic say? You really want to look at multiple sources. And if it sounds like a lot of work, it can be a lot of work. It's a lot easier to just get an AI result on ChatGPT and say, oh, Chat told me this is what's wrong with me. But you're not going to get the best results from that.
Another thing we're seeing sort of in this space, and in the history of time, there have always been places where we've had misinformation, and that misinformation has spread. But it seems like it impacts us on a daily basis as we're scrolling through our phones. So how do you spot that misinformation and disinformation, whether it's in social media or it's in a Google search you just referenced, or an AI pull of some health information?
Really, first and foremost, is big claims that seem too good to be true, or that seem really simplistic. Like, the birth control pill is just bad for women. It's like, hold on a second. Like, maybe for some women, but like, that is a broad claim. And someone making that big, broad claim really should be raising a red flag and make you say, like, what else is this person talking about? That like I might have to fact check, or who else is saying this, So really big claims, I think, is big. You have to check someone's credentials as well. So there certainly are a lot of medical doctors who are making big claims like that, where I might say like, that doesn't feel right on to me. But there are also people who are like, maybe have taken like a 3-hour nutrition coaching course and now are dishing out all kinds of information about supplements and food and how it works in the body. And you're like, if you dig in, you're like, well, what actually is your training? And so I think we really have to be checking credentials. If someone is making a claim about our health, like, what makes this person qualified to do that? I think also it really is important to take a look at trends that are going around on social media. I think sometimes the salacious can really be what goes viral. It catches wind and everyone's like, oh my God, this is true. And it's like, okay, so any of those big trends that are going wild, just take a step back. Again, use that as one of those red flags to Google like a doctor, or to sort out misinformation like a doctor, or a health journalist, and say, hold on, I'm going to do some background research on this to make sure it's accurate, And then I think finally, on the misinformation and the disinformation front, something I feel passionate about, and a lot of experts say, is like, speak up against it. Like, for example, there's a lot of misinformation and disinformation around vaccines. And I try to do my part in a way that feels good for me, to say, hey, if I see misinformation, I might say, hey, have you seen this article, which offers another perspective that's based on evidence? These are not easy conversations to have, but I feel like it's our duty when we're seeing misinformation to speak up about it, especially as it relates to our health.
Yeah, and I think it's also, and you touch on this in the book, it's our obligation to sort of look at what we're consuming and make sure that we vetted it before we share it again, so that we're not continuing that chain of misinformation and spreading it to all the people who are in our networks.
Totally. And I think another thing too, you did such a beautiful job in your first season of really talking about like how to really navigate the healthcare system. And this is one way we can also use the healthcare system. Hopefully we've got clinicians who we really trust and admire. And you can actually say that in an appointment. Let's say you're in a doctor's visit for your PMOS symptoms and you're talking through that. You might say, hey doc, like, I'm seeing this all over social media right now. Like, what does the literature show? What does the research show? What do you think about this? It's what I get to do for my job, which is, wow, there's this trend going on and I'm hearing all of this crazy stuff about women's health online. And then I get to call like the preeminent doctors in the field and say, what do you think about this? But we can all do that with our own clinicians. We can all, and it doesn't have to be like a special appointment. You could just be like, what's your take? Is there legitimacy here, or is this a whole bunch of like smoke and mirrors?
Yeah, I love that. And I would never think to say to a doctor, which I should going forward. I saw this on TikTok and they are selling this, and this to help me get through this phase of my life. Do you think that is something that I should look into, would be helpful for me? Because like you said, it's trends. Once something picks up on social media, it is everyone sort of spreading that same message.
And I think the other thing to keep in mind, what I see a lot of right now is on podcasts, actually. A lot of these really big podcasts, they'll pull out like a clip of a doctor saying something, and it's always the most wild sounding claim. And when you actually listen to the podcast, it might not be as crazy. It might be this really salacious clip to try to get people to click. And so keep that in mind as well. A lot of these trends, what you see on social is this like teeny tiny clip of something to get you to click in. Get as much context as you can to help you make sense of who's saying what and what's actually legitimate or not.
Yeah, and one of the things I've gotten into the habit of doing is, and like you, I'm in a lot of conversations around women's health with experts around the country. And as I'm hearing them talk about things, I make lists of things that I want to go and look at later. And I want to think about how those things impact me in my life, because when an expert is on stage or an expert is delivering a podcast, they can't tell you the whole story in that short period of time. And it's really important to sort of take it for what it is, appreciate that there's so much nuance in how things play out in each of our bodies. And we each have different factors that contribute to how things play out. So I think it's really important to just say, okay, I heard that expert say this, but I need to do a little bit more digging to see how it applies to me.
Yes, it's such a beautiful point. And it's like we have to take information and then personalize it.
So what other advice do you have, Meghan, for women as they are navigating healthcare?
Overall, it's like we have to take ownership in a new way of our health than we did before. So I think oftentimes of my mom, who had the same primary care physician for about 30 years. That's remarkable. And that is something that will not be part of my healthcare journey. It's just things don't go like that anymore. Doctors move, PCPs especially, not too many of us don't have a primary care physician and that continuity of care. And I think as a result, we really have to take ownership and say, okay, what is my medical record? What is my personal health history? What is my family health history? How can I document that in a way that makes sense for me and in a way that makes it easy for me to bring this to all the new doctors I'm going to see or all the specialists I'm going to see at some point? If you're, digital friendly, put it in a notes app, like create something. Maybe there's an app that exists that you really like that's safe to house your medical information. If you're hearing this and you're like, gosh, that sounds like a really good idea, like now is the time. It'll build from when you start it, and it really will make your life easier and it will help your care. So I think that's first and foremost is like we have to own our health in a new kind of way. And then I think too, we have to educate ourselves enough to be able to have really empowered and knowledgeable conversations with our doctors because their time is short. We can't go into a doctor if we're in the menopause transition and say, so tell me about the WHI and how that really messed up women when it comes to hormone therapy. And it's like, that is a pure waste of your time. Your doctor does not have enough time. And that is information that is readily available that you can educate yourself and really say, oh, I understand why so many women got gypped out of hormone therapy and menopause. And now I don't have to be. And the better question is like, okay, so I understand that the WHI findings are now being debunked and the new thinking is this. But given my health history, what do you think about starting me on estrogen and progesterone in menopause? That is a different question. That's going to get you a lot further in that appointment. And it's going to make your doctor say, oh, cool. Okay, this is someone who's coming in here with a baseline knowledge. We can cover more ground. I had a personal experience of this. I did have a new primary care physician right around the time I was finishing up reporting the book. And her eyes, she was just like sparkly. She was like, wow, this is going to be such a fun appointment because you're coming with like this baseline knowledge that's going to help us cover more ground. It's going to help us go deeper. And that's my hope for every woman. It really was, again, I kept that image in mind as I was working on this book because I was like, gosh, if every woman could have that, our healthcare would be totally different. We'd feel differently about how we care for ourselves and the care we get. And we can take ownership and make that happen.
I can speak to the physician's eyes lighting up. I have worked in healthcare for 23 years, but it was only after reading your book, talking to the experts that were on season 1, that I actually said to myself, wait a second, you haven't been a very prepared patient when you've gone into appointments, right? You had some of the stuff, but mostly it was, as we said in the last season, a Hail Mary pass, right? I'll figure it out when I show up. I'm sure I'll remember all my questions. Never did. But I did what everyone said, and I put together the digital binder of my medical record. I looked at my blood results over the course of the last 6 years, and it was eye-opening to me in the sense that I could see trends in my numbers that I had never realized existed. But it was eye-opening for the doctor, too, because she was like, oh, great, we have all this data. We can start from this point. And that was so helpful for both of us getting to the result that we wanted out of that appointment.
Totally. And a bonus, I think, of doing all of that, it's not just good for you, but it also helps you gut check to make sure you're with the right clinician. So if you get a doctor, if you do that kind of beautiful work and say, hey, gosh, I'm looking at my own trends. Can you help me make sense of this? Because here's what I'm seeing, but what do you think? And if the doctor gives you the eye roll or looks annoyed, if you have any choice when it comes to finding someone else, I would say that's a clear sign you need to find someone else, right? Because we want to partner with doctors who want to make shared decisions with us. That's a big trend in medicine right now, is shared decision making. We as patients need to be part of the process. And if we don't have doctors who want us to be part of the process, you're fired.
100%. Well, Meghan, thank you for being with us, and thank you for being one of those women that is pushing all of this forward. Your book is remarkable. There's so much information in it and so much that we can all learn from it, not just in one sitting, but sort of as we go through the next few years, even longer than that in our life. So I'm so thankful to you for being with us, for doing the work that you're doing. It is making a huge difference for all of us and the healthcare that we receive. So thank you again.
Well, thank you. I've loved chatting with you today.
You can find more information about Meghan's book and where to buy it in the show notes or on our website, womenshealthplaybook.com. And to get more women's health resources sent right to your inbox, subscribe to our Substack at womenshealthplaybook.substack.com. Thank you for listening to the Women's Health Playbook. We hope this episode helps you receive better care as women in the United States. If you want to dive deeper into the tactics and resources we discussed today, you can find those in the show notes for this episode. The Women's Health Playbook is a media company focused on ensuring you have the resources, tools, and skills you need to navigate healthcare. For more plays and picks you can use to take control of your health and healthcare journey, visit us at womenshealthplaybook.com. Our producer is Avery Moore-Kloss. You can find her at averymoorekloss.com. I'm Priya Bhathija. Catch the next episode of the Women's Health Playbook right now in your favorite podcasting app. We hope you will share this episode with a friend, because the more we all know, the better healthcare will be for everyone.